hurricanes, they think earthquakes, they think tornadoes, heat. But one of the things that's becoming more of an important thing to be able to pass along is sending information also about nuclear. You're going to be talking, Charles Miller from the CDC is going to talk a little bit more about spreading the message about a nuclear public health emergency. Thank you, Charles.
Thank you. Good morning. I think this is working. Good. Well, we just had a very good talk, one of many this morning. Man, I hate to be this late in this program. It's a really good one. We were just talking about experiential learning, of which I, like many of you, learn best from, I'm afraid. But I'm now about to talk about a subject which I hope and pray we never experience. Last time I was with you was in 2008 out in Denver, and there I reported to you on some results of some research that we had done at CDC, and it was some focus group research, and we talked with members of the public, first responders, and clinicians. And one of the things they all told us was, number one, they want to protect themselves and their families in any kind of a nuclear or radiological emergency. That's their first priority. Clinicians, for example, are not going to report to their hospitals to treat patients until they know their families are safe. That message has come through loud and clear. Where are they going to get this information? Well, as I told you then, they told us they're going to look to their local broadcast meteorologist for that information. You. And, of course, I told you then as well, and I'm sure you're not surprised. I mean, you're in our homes every day. I saw Ken Cook at breakfast yesterday, and I wondered for a moment, for a second maybe, why he didn't recognize me. You're there for the daily forecast, severe weather events. Ken and his colleagues in Atlanta interrupt my TV all the time when we have severe thunderstorms like last weekend. And, of course, you're there for man-made disasters. And in 2008, we had just had the large chemical fire in Conyers, Georgia, which is to the east of Atlanta. And, again, Ken and his colleagues in Atlanta gave us a lot of information about that. Well, this research clearly showed that you are more than just meteorologist, you're the station scientist. And so we partnered with the Committee on the Station Scientists to help update the web page, and you'll see that referenced here. It was, I believe it was introduced to this group last year at this time. The web page includes information such as suggested pre-event actions on your part, some links to the educational resources that we at CDC have, and I'm sorry I haven't gotten to my stuff in Disney World yet, but maybe we need to work on that, and some information for contacting CDC. You've even got my telephone number if you're really serious. Now, every year in the United States, we have what we call national level emergency preparedness exercises. And I say national level, these goes up to the highest levels of government. The White House participates in these exercises, and I mean that seriously. The scenarios that are used every year vary. They're rotated. In 2011, for example, it's going to be an earthquake on the New Madrid Fault. Well, for 2010, this year, the scenario that was selected was that of an improvised nuclear device, i.e. an atomic weapon explosion. And it was designed to go off in Indianapolis, Indiana, very near where I lived for a long time. The exercise was conducted the week of May the 17th. Now, if you're from Indianapolis and you're wondering, oh, I didn't hear about it, well, don't worry, most of the exercise play actually took place in and around Washington. As I say, this was involving a lot of top-level people. Now, what happens whenever you're doing or preparing one of these exercises, all the agencies begin to look at their plans and begin to make sure that they're prepared for the exercise. That's why you do the exercises. Well, this is going to be an IND exercise, an improvised nuclear device. And so a lot of planning was beginning to take place. Well, in January of 2009, the White House issued some planning guidance for response to a nuclear detonation. And the website there at the bottom of this slide will tell you how you can get hold of it. It's a public document. You can go read it for yourself. It's currently being revised and will run up to NLE 2010, and it may be out there today. I'm not sure when it's going to be reissued, but scheduled to be reissued very soon. One of the new chapters, or at least a revised chapter in the new document, is going to be on communications and emergency public information. Because as they began looking at the old document and began thinking about INDs, they realized communication, communication, communication. Now, this is a diagram from that new documentation that I'd like to share with you just to give you an idea of what we're talking about. This diagram is designed to show you the impact of various kinds or various sizes of nuclear detonations. And these are assuming a ground level release in an urban environment. By the way, we have no experience or any kind of a detonation of a nuclear weapon in a modern urban environment. There are 3 devices shown here, and I'm sure most of you, if not all of you, are familiar with the fact that in the nuclear weapons business, they designate the yield or the impact of the device in terms of tons of TNT equivalent. So we have a 10,000-ton TNT equivalent device, a 1 KT device, and a 0.1 KT device. Again, ground level releases. They divided this into 3 zones: severe, moderate, and light damage. And this is from the new document because there's a slight difference, and I'm going to mention that in a moment. Make sure I get this right. The severe damage zone is considered basically the zone near ground zero where the device is exploded. Basically, in the severe damage zone, you're not going to find much left standing. Structures are gone, the radiation levels are very high, and few people are going to survive. In fact, in the old documentation, the one that's currently up on the website, or it was when I checked last week, that was actually called the no-go zone, because what they're going to suggest and what the guidance suggests is if you're an emergency responder or you're responsible for emergency response, you do not send rescuers into that zone looking for people. Because anybody who's still alive is, to use the medical term, expectant. They will die, is the expectation. There hopefully will be some exceptions, but not likely. You go out a little bit further and you get into the moderate damage zone. There are substantial building damage. There's elevated radiation levels, but casualties here might be expected to survive, at least some of them. And finally, you get into the light damage zone, where the damage is quite variable, doors, windows blown out. Radiation is certainly there, but again, survivable. And you'll notice that for a 10 KT device, we're talking 3-4 miles or more for the light damage zone, half a mile for the severe damage zone, and in between. Now, you'll also notice that these pieces of a circle, if you will, and the lines between them are very, very fuzzy. You see, these are all model projections, and they are highly uncertain. And I'm reminded of a phrase that I like to use or have used in the past when I was teaching modeling for various things, and that is, all models are wrong, and some are useful. And I've heard many of our speakers the last 2 days, without using those words, said the same thing. So you might want to borrow that. So here's some fuzzy ideas of what you might expect. But there's going to be more to it than that. You're going to have to be concerned with what we call fallout. Basically, this is the debris that's sucked up into the mushroom cloud, if you will, and gets blown around. It's radioactive. Part of that fallout as it goes downwind is going to be dangerous fallout. And if you look at the document, the radiological part, the definitions are there. But the point is, in that zone, there are people who can actually suffer acute effects, workers, etc., and those people are going to have to get out of harm's way or do something, or there could be serious effects. In addition, there's going to be not lesser levels of fallout. They're going to keep on going. Here you see for a 10 KT, it goes out for maybe 20 or 30 miles, the dangerous fallout zone. The lesser levels of fallout are going to go on for a long distance. In fact, for those of us in public health, I'm expecting that we're going to be concerned about a fallout plume from the time it leaves the detonation until it completes at least one circumvention of the globe. If we have a nuclear detonation in Kansas City, those of you to the east in Washington, D.C., New York, it's coming your way. And your viewers are going to ask you questions about it. If you're in Los Angeles, be prepared, because it's going to go around the globe, and with the instrumentation we have in the radiation business, we're going to measure it when it comes back across the West Coast. Is it going to be dangerous fallout? No. Are people going to be concerned about it? Absolutely. I am still involved in projects and answering questions from members of the public quite often concerning fallout that was released from the Nevada test site in the 50s and 60s. Well, if we're going to save people's lives in an event like this, effective communication is going to be the key. Now, as part of this run-up to NLE 2010, there's an interagency group that's been developing key messages for delivery in the event of an IND. They're cataloging them and getting them prepared. The Department of Energy is developing what they call briefing products for decision makers, the people in your community that have to make some decisions. And it includes maps that may be made available to you at the same time. Now, one complicating factor when it comes to communication is there's one other thing that I haven't shown you before. It's not on the map. And that is, during a nuclear detonation, you're going to have what's called an electromagnetic pulse. And then you'll notice I have the next word, and I chose it carefully. Could, because we're doing an awful lot of modeling here again. But the nuclear weapons experts, and I am not one of them, say that when a nuclear detonation occurs, there could very well be what's called an electromagnetic pulse, or EMP, that could go out for about 2 to 5 miles, depending upon the size of the detonation, and it will totally disrupt electronics. Forget about your radios. They're gone. Forget about your televisions. They're gone. Forget about your computers. They're gone. Maybe. So, we're going to have a communications issue there. Now, how can people protect themselves from radiation, especially those people who are in the little farther out in that dangerous fallout zone, or people who are in the other fallout zones? Well, the natural tendency is going to be to flee the scene of the detonation, to get out of town. That certainly would be my first thought. But fleeing may actually result in an increase in harmful radiation exposure. In this business, we have what's called the 7-10 rule. It's not absolute, but it works pretty good. And basically it says for every 7-fold increase in time after detonation of a weapon, there's a 10-fold decrease in the radiation rate. Basically, the radiation products that are created in the detonation oftentimes have what we call very short half-lives. They decay very quickly. If we can get people inside while that is decaying, that may be, and often is, safer than having them trying to run away, because where are they going to go? They're going to go right through that plume if they're not careful. So, the key immediate message, and I don't know what the final official federal whatever ruling is going to be and how this is to be stated, but I'm going to tell you what I think it should be. This is just me now. Actually, I borrowed it from our British friends, but I think it's a real good one. Basically, the message is this: to get out to people who are not in that immediate blast zone, go in, stay in, tune in. Go in. Seek shelter in the nearest and strongest building you possibly can. Go as deep inside the building as possible. If you've got a basement, go into it. If you've built a fallout shelter, tornado, maybe, yes, if you're in a tornado area, maybe build a tornado cellar. Go in there. Stay in there. Do not come out until instructed by your local authorities. And that may be an hour, it may be 3, or maybe more. Tune in. Listen to your radio, television, or the NOAA weather radio broadcast for updates and instructions. Now, this obviously is not going to work within that EMP zone, but outside of that, this is the key. So what can you do as broadcast meteorologists? First of all, continue to develop strong working relationships with your local emergency managers and decision makers. Nothing new there. You just heard it a minute ago. Provide comments on the new communication products whenever possible. Hopefully the managers around the country are going to begin to look at these things. I want you to look at them. One of the concerns that we at CDC have is we've developed these messages, experts have developed the messages. Can your audiences understand the messages? I understand them just fine. Can your audiences? And then know what messages your community leaders will want you to broadcast, and be prepared to broadcast them. The messages will vary somewhat and will have to be tailored from community to community. But what does your community want? A nuclear detonation in this country is going to be a horrible disaster. But we can find people, help people to survive if we all work together. And I really appreciate the opportunity to partner with you in this very important process that I hope we never have to experience. Thank you.